I'm Dr. Kyle Amspaugh. Everybody here at the office calls me Dr. Kyle. We've been here at this facility, Blanchard Valley Pediatric Dentistry, started in July of 2009, and we've been here going strong for the last 4 years. Pediatric dentistry is something that I really enjoyed in dental school. It's something I really love. The kids that I worked with had a very good response to the way that I treated them, the way that I provided their care, and that's what made me really get into pediatric dentistry coming out of dental school. The question I get asked all the time is, what is the difference between a pediatric dentist and just a regular general or a family dentist? There's really the level of care, the dentistry that's provided is very similar. Kids themselves, their teeth are very similar to those of adults. You're providing the same kind of dentistry, but pediatric dentistry, where it differs is more of the growth and development and the understanding of a child's kind of their emotional development as they grow. Obviously, the big thing that I was always told in dental school and learned quite quickly is children are not just little adults, and the way that their care is provided needs to be in a way that's appropriate for their age levels. And a pediatric dentist receives extra training during typically a 2-year post-dental school training that allows them to more properly gauge the developmental stages that a child goes through and provide the care accordingly to make sure that they have a good experience, because that's what pediatric dentistry is all about. It's about getting children off to a good start in their oral care and making them feel comfortable for years to come, and kind of developing that good oral health habits that we as adults need to have to maintain a long and healthy smile. One of the primary focuses in pediatric dentistry is on prevention, and many children that see a general dentist oftentimes aren't seen until they're 3, 4, 5 years of age. As a pediatric dentistry, the big focus is stressing to parents that most children need to have a dental home or need to be examined by age 1. And although that seems very early for most parents, most of what we're doing is education. So not only are we examining the child, making sure that their development is coming along quite nicely, but what we're also doing is we're educating the parents on the proper way to take care of the kids. So when they get to those ages of 4 and 5 years old, we've already kind of figured out what the potential problems are and kind of made sure that a lot of the issues that children have as far as dental decay, oral hygiene habits, and things that really can put their oral health in jeopardy, we've kind of figured out what those are, and we've corrected any problems, and we've educated the parents on how to properly care for their child's teeth. Working with children is every day is a different challenge. It's lots of fun from my perspective, because every day when I come to the office, I don't exactly know how the day is going to go. Kids are very funny. They're very honest. If you ask them a question, 9 out of 10 times they're going to tell you exactly what you want to hear, and sometimes what you don't want to hear. But kids are very fun to work with. It makes my day very exciting. It makes my day very happy, I should say. It's always a happy environment around here. The staff is always in a good mood because of the kids, and it just makes the days lots of fun. Here at Blanchard Valley Pediatric Dentistry, my big focus when I started the practice is I always wanted families that would come in to be in a comfortable environment and a very trusting environment for the kids. When they come in, I want them to feel like they are still in control of their environment, that they're having a good time, and that ultimately that they want to come back. And I think every child deserves to be treated with compassion. Every child needs to be treated with very top quality dental care. And combining those two is sometimes very much a challenge as a provider. But there was always a rule of thumb that said never make the treatment worse than the problem. So when these kids come in, my goal is to make sure that when they walk out, they always have a smile.